Hi, I'm Dr Jason Thomson, dermatologist and head of medical at Skin & Me. In this video, I'm going to talk to you about a distressing but very common condition, acne. Many people spend years trapped in a difficult relationship with spots or acne. Almost all of us will develop acne in our teenage years, where it affects up to 90% of us. Acne that develops after the teenage years is referred to as adult acne, and this occurs more commonly in women, with up to 45% of women affected. Today we're going to take a deep dive into the different types of spots, discuss their causes, and talk about how you can manage them. Although it can be a stubborn and often difficult and upsetting condition, with the right approach you can effectively treat acne and promote clearer, more balanced skin. Blackheads and whiteheads are the most common type of spot, and most of us will be very familiar with them. A whitehead is a small raised white or skin-coloured spot that forms when excess oil and dead skin cells clog up the opening of a pore. The pore remains closed, which is why it looks white or skin-coloured, and this is why we call them closed comedones. A blackhead is a small raised spot that appears black in the centre. It forms in the same way as a whitehead, a pore clogged with excess oil and dead skin cells, but this time the pore opening is widened. And the black colour is not due to dirt as commonly assumed. Rather, it's caused by a chemical reaction that occurs when the material blocking the pore combines with oxygen and turns black. The pore is widened in blackheads, which is why we call them open comedones. Blocked pores provide an ideal environment for bacteria that normally live in our skin to grow and multiply. And this can result in inflammation and the formation of a yellow spot filled with pus, and that's what we call a pustule. The same process with bacteria and inflammation in the pore can cause a red spot without pus, which we call a papule. Sometimes the inflammation in the pore can go deeper into the skin, resulting in a lump under the skin that we call a nodule or cyst. These are usually bigger and more painful than papules and are more likely to result in scarring if left untreated. Acne is a disease of the follicle and oil-producing glands of the skin, also known as sebaceous glands, and a number of processes underlie the condition. First, the sebaceous glands produce too much oil, usually in response to messages received from sex hormones estrogen and testosterone. This is one of the main reasons acne appears during puberty, when sex hormones are at their highest. This also explains why some people experience acne breakouts around the time of their period, which usually coincides with raised sex hormones. At the same time, the follicles become clogged up with dead skin cells that become sticky and are not shed properly. These factors result in a build-up of oil and dead skin cells that clog pores and result in the formation of blackheads and whiteheads. The bacteria Cutibacterium acnes also plays a role in acne. This bacteria is found on most people's skin without causing any issues. However, in acne-prone skin, the excess oil creates an environment where it leads to overgrowth of the bacteria, triggering inflammation leading to red, pus-filled spots. Lifestyle factors have not been found to cause acne, but can contribute to it. Mild to moderate acne can often be improved with topical treatments which are applied directly to the skin. If you go to dermatologists, they will assess your skin and you might be given antibiotics like clindamycin and erythromycin. Other prescription ingredients like tretinoin or over-the-counter active ingredients like azelaic acid or benzoyl peroxide can also be given. More severe acne may require a short course of oral antibiotics from a doctor. Isotretinoin, often known by the brand name Roaccutane, is an oral medicine prescribed by dermatologists to treat acne that is too severe for topical treatments and oral antibiotics, or hasn't responded to these treatments. Isotretinoin has an anti-inflammatory effect and reduces the production of sebum, which can stop spots forming. So no matter how tempting it is to squeeze your spots, it's really important that you resist temptation, because squeezing can actually push the inflammation deeper into the skin and leave you with scarring. If you feel the urge to squeeze, then take a deep breath, step away from the mirror and distract yourself. Spot patches are a great option. Now, these work by absorbing fluid in the spots, reducing healing time and acting as a physical barrier. I hope you found this video helpful. If you're worried about acne, speaking to your GP can be a good first step towards getting the right treatment. Alternatively, acne is also one of the most commonly treated conditions at Skin & Me. Our dermatology team can study your photos, consultation form and medical history to create a tailored treatment just for you.